Thank you. Good morning, everyone. Bonjour tout le monde. Ani. My name is France Gélina, and I'm the MPP for Nickel Belt. I would like to introduce the good people that are with me today. Starting on my left, your right, I guess, is Jackie Walker. She is the Vice President of SEIU. Next to me is the President of ONA, Mrs. Erin Ariss. To my right, your left, is Dickon Worsley, who is the President of WeRPN. And next to him is Sandy Joan, Vice President of Nursing for SEIU. Thank you for being here this morning. We are here because this afternoon we will be debating on second reading my bill to bring nursing ratios. We want people to understand that nursing ratios in our hospital is a win-win-win. What do I mean by that? It is a win for patient. There is copious data and evidence that shows that nursing ratio decreases mortalities in hospital. They decrease the readmission rate of people who go home and have to come back. They decrease the length of stay in hospital. Nobody wants to be in a hospital any longer than they need to. Nursing ratio helps you do this because hospital-acquired infections are lower, etc. It's a big win for patient. It's also a win for nurses. Right now, our healthcare system, hospital system, is in crisis. We've seen thousands of ER closures, hospital services closure. The main reason for that is a lack of nurses. The main reason for that is that our nurses are burnt out. Nursing ratios has been proven to truly help with the burnout. And we're talking like 40% to 60% less sick days, less long-term disability for nurses who works in an environment where there are nursing ratio. It helps with recruitment and retention of nurses in our hospital, a win for nurses. The third win is a win for hospital budget. Again, the data is there to show that hospitals that have implemented nursing ratios, and they have been trialed throughout the world. California was one of the first one to implement nursing ratio more than 25 years ago. It has been tried in Queensland, in Australia, in India, in the UK, all over the world. And it always leads to huge savings to hospitals who implement nursing ratios. So that this is a fix for the crisis in our healthcare system that we could implement right now, very much the same way that British Columbia is implementing it in their province right now. And to find out a bit more, I would like to invite Mr. Dickon Worsley from WeRPN.
Thank you. Good morning, everyone, and thank you, MP Gélina, for inviting me here today to join fellow nursing leaders in support of your important bill, the Patient-to-Nurse Ratio for Hospitals Act 2024. My name is Dickon Worsley, and I'm a president of the Board of Directors for the Registered Practical Nurse of Ontario, also known as WeRPN. I also worked in direct patient care at a hospital in emergency room. RPNs are the second largest group of regulated health professionals in our healthcare system, with over 59,000 across the system. Every day, my colleagues and I work in hospitals, long-term care, and across our health system in every corner of the province to ensure that Ontarians have the quality of care they deserve. But the reality is the current system makes that far more difficult than it should be. Too often we are short-staffed and forced to make impossible decisions. Do we provide full breadth of care we know the patient needs, or do we move on and provide the bare minimum to make sure the patient gets seen? Simply put, we need to increase the number of nurses per patient in our hospitals to fix this. Legislating nurse-to-patient ratios will allow nurses like myself and my colleagues to deliver improved patient care. Better care will help reduce length of stay in hospitals, which in turn will free up hospital beds and reduce system capacity challenges. For nurses, it will improve workloads and reduce stress, help to boost pride, and to make the profession that we love the valued, respected, and attractive career it used to be. MPP Jalene, patient-to-nurse ratio for Hospitals Act 2024 presents an opportunity to address these two challenges, the need to improve patient care and the need to retain nurses in our health system. It is a critical step to help Ontarians receive the quality and timely care they deserve. In recent years, understaffing has become normalized and nurses are stretched thin. This has compromised patient care and led to morale distress and has caused many RPNs to consider leaving the profession. In fact, in our recent annual survey of RPNs, 48% of respondents indicated that they were considering leaving the profession, with wages and workload cited as leading factors. However, when we asked those considering leaving what would make them stay, 72% cited nurse-to-patient ratios as a key factor. Clearly, it is time to recognize the value of the work nurses do for the Ontario healthcare system and to recognize how important nurse-to-patient ratios are. Legislating nurse-to-patient ratio would ensure that nurses have manageable workloads to provide the highest quality of care for their patients. It would also strengthen the retention and recruitment of nurses in a profession at a time when the need for nurses is expected to grow. This legislation is based on decades of research that clearly details how nurse-to-patient ratios improve patient outcomes, reduce mortality rates, and decrease the length of hospital stays. Patients who receive care from nurses with lower patient loads are more likely to be satisfied with their care and a better overall experience. Legislating nurse-to-patient ratio is not only good for nurses and patients, but also has been shown to provide a major return on investment for our hospitals and the health system. In 2021, a study in the United States found that a 4-to-1 staff ratio prevented more than 1,595 deaths yearly and would save hospitals $117 million per year. This bill has the potential to save lives and do so affordably as a province responds to a continuing healthcare crisis. On behalf of RPNs across the province, I urge all MPPs to support this important legislation. This is a critical issue that affects the health and well-being of our communities today and tomorrow. Let's work together to ensure that our hospitals are adequately staffed and that nurses have the resources they need to provide the highest quality of care for our patients. Thank you. And I'd like to introduce Erin with ONA, President of ONA. Sorry.
Thank you. Good morning, everyone, and thank you for joining us today. My name is Erin Ariss. I'm a registered nurse and the president of the Ontario Nurses Association. ONA represents over 68,000 nurses and healthcare professionals in every part of Ontario. We also represent 18,000 nursing student affiliates who are the future of healthcare in Ontario. We are here today at Queen's Park to call on MPPs to vote in favor of safe nurse-to-patient staffing ratios. Ontario is in a healthcare staffing crisis. For years, we've had the worst population to registered nurse ratio in Canada. And according to data from the College of Nurses of Ontario, an unprecedented 35,000 nurses have left the sector between 2018 and this past fall. And this number continues to increase. Nurses are spread far too thin. We work short-staffed every single shift, and we are burnt out. We simply cannot keep up with the number of patients admitted to hospitals. We are stretched to the limit, sometimes working 16 and 24-hour shifts because there is no nurse available to take over. When there are not enough nurses on the floor, patients don't get the life-saving care they need and deserve. And this cannot continue. As understaffing takes its toll, stories from patients are emerging: ongoing hospital closures, long wait times, and emergency department chaos. This is the reality of healthcare in Ontario today. We've heard from nurses working in intensive care units with the most seriously ill patients who should normally provide care in a 1-to-1 patient-to-nurse ratio. These nurses are now caring for up to 5 or more patients at once. That is an impossible, unsustainable job for any nurse, and it's not fair to our patients, your loved ones, who do not get the dedicated care they deserve. But it doesn't have to be this way. Nurse staffing ratios are a solution to this crisis. They improve patient care, they improve health outcomes, they reduce the length of stay for patients in hospital, and thereby lower public costs. Staffing ratios make workloads more manageable and ensure patients receive the high-quality care they deserve. Nurses are watching this bill, and nurses are watching this vote. This is a vote for high-quality patient care. It is a vote for nurse retention, a vote for safer hospitals. We need the Minister of Health and MPPs from all parties to come together to vote for patient care and to support this crucial legislation. Thank you. Next, we have Jackie Walker, Vice President of SEIU.
Good morning, everyone. Once again, I'm pleased to be here with MPP Gélinas, who time after time continues to bring solutions forward to have a strong, universal public healthcare system in Ontario. My name is Jackie Walker. I served as a frontline registered practical nurse myself, and now I'm proud to serve SEIU healthcare members as Executive Vice President. The Patient-to-Nurse Ratio for Hospitals Act is good for our health. It's a solution for patients to be served well by well-staffed nurses. Today, patients are at risk because of lack of nurses, and nurses are at risk because of unmanageable workloads that contribute to burnout, and workloads that drive nurses prematurely to retirement. What Mr. Ford is doing is a prescription for hallway, healthcare, and emergency room closures. Premier Ford likes to say the old business adage, you can't measure it if you can't manage it. Bill 192 is about measuring the nurses we have so that they can manage the care patients need. Nurse-to-patient ratios turn dangerous and disorganized care into safe, personalized care. As I like to say, nursing ratios let nurses be nurses. Nursing ratios, they reduce wait times, and nursing ratios save lives. SEIU is here to call on you, Premier Ford, to vote yes to nurse and patient ratios, to send Bill 192 to committee, and to expedite the passage of Patient-to-Nurse Ratios for Hospitals Act. Let's end the chaos and the closures of Ontario's hospitals. Let's give people strong public health care with strong nursing ratios. Registered practical nurses and nurses across Ontario, we're ready. We're ready to step up and serve. Our message to Premier Ford is help nurses and fund nurses. Thank you.
Thank you, everyone. Thank you for your comments. Merci beaucoup, tout le monde. Ça nous fera plaisir de prendre des questions en français ou en anglais. We're open to take questions in English or in French.
France, peut-être juste parler de l'exemple de la Colombie-Britannique. Je sais que c'est assez récent, mais est-ce qu'on veut à peu près avoir le même modèle ici en Ontario?
Oui, la Colombie-Britannique a, depuis pas tout à fait un an, commencé à mettre en place un ratio d'infirmières avec un nombre de patients dans différents départements. Mon projet de loi est identique. Si on regarde quelqu'un aux soins intensifs sur un ventilateur, c'est 1 à 1. Dans les soins post-chirurgicaux, c'est 1 à 4, etc. Les ratios sont identiques, mais je dois te dire que les ratios sont pas mal identiques partout. Si on regarde ce qui a été fait tant en Australie qu'aux États-Unis, c'est pas mal les mêmes ratios un peu partout. C'est en train d'être mis en place en Colombie-Britannique. On a déjà vu plusieurs infirmières qui venaient de prendre leur retraite, qui reviennent parce qu'ils savent maintenant qu'ils vont avoir des tâches qui est faisable et on voit que ça commence déjà à être un gros succès en Colombie-Britannique et ça vient à peine, c'est en train d'être mis en œuvre.
Puis un peu toujours la même question, mais est-ce que vous avez espoir que le gouvernement soit d'accord que ça se rende en comité, ce projet de loi?
Bien, je te dirais, on vit dans une démocratie. Si tu as des centaines de milliers d'infirmières qui demandent au gouvernement de mettre ça en place. Tu as les patients, tu as les gens qui travaillent dans les hôpitaux qui demandent au gouvernement de mettre ça en place. C'est une stratégie vers la crise qui améliore les soins aux patients, améliore le recrutement, la rétention des infirmières et diminue les coûts des hôpitaux. C'est pas mal difficile de dire non, mais on va voir qu'est-ce qu'ils vont dire cet après-midi.
We know the Premier loves talking to hospital CEOs about healthcare issues. What do they think of these ratios?
I would say the great majority of them understand the data behind them, have seen how it has been successful in many, many parts of the world, whether in Australia, Queensland, whether in California in the States, whether in India, whether in the UK, they are on board. They know full well that it would help their hospital tremendously. The wait time in the ER, the overcrowding in their hospital. If a patient doesn't stay as long because the care is more appropriate, then it helps. They are on board.
Why the need to mandate it?
The need to legislate it to effect the change, to make sure that it becomes a priority, to make sure that it is done in every hospital and in every department of our hospital. It is a change from the way that we do things. It is a change that affects some of the unions that are with me today. So they are there to show that the unions are willing and able to have those discussions with their employers, which happens to be the hospitals, who are also willing and able to have those discussions. Let's move this forward to legislation and let's legislate this.
Have any of the unions or you leaders up here had discussions with leadership at hospitals about doing this of their own accord?
Yeah. Jackie from SEIU Healthcare. We definitely, as a union, put forward nursing ratios when we go to bargaining. We've done it in long-term care. We did it in the hospital sector at our last round. And, you know, there isn't a response. Actually, the response that I hear is, well, that's something that the government can do. So that's why we're here, to put the pressure and to let the government know that the WeRPN and the unions, we have a solution, right? And we need the will of the government to make this happen, because let's not pretend like it doesn't cost money to make big system changes like this, right? And like Fran said, we need the government to mandate it because it's not something that people are going to do willy-nilly. And I think that that our hospitals need the guidance, right? And that it needs to be a provincial action to make sure that everybody's experiencing the better care and the better service from nurses.
I can add to it as well that hospital CEOs, there really is no other choice. This is the solution to everything that they require. They do need to shorten length of stay. They do need to expedite care in emergency departments. But it does have to be system-wide, just as it is in other jurisdictions, like British Columbia, like California, where California in particular, it was legislated and it is a proven success. But if we went to individual CEOs and you implemented ratios in one spot and not the other, or even trialed them in one hospital versus the other, I can guarantee you that hospital would not have staffing issues. There would not be a crisis in that hospital, but it would perpetuate it in other hospitals around it. And we don't want to see that happen.
Do we know how many more nurses this would require to implement province-wide, assuming you follow BC's lead on ratios? And are there enough in the pipeline?
There are nurses, but they're not at the bedside right now because the atmosphere, the care environment is chaotic, and they cannot meet the needs of their patients. I would almost guarantee that those nurses who have chosen different careers, who have gone elsewhere to work, will return to the bedside if this legislation passed.
I have no idea if we have people online. Does anybody know that?
No callers.
No callers? Okay, well, there you go. Okay, thank you. Any more question, anybody? Thank you for coming. Merci beaucoup d'être ici aujourd'hui. And we'll know about the vote. It was supposed to be at 6. I'm told it'll probably be more around 4:30 that the vote will take place this afternoon. Hopefully it passes. Thank you. Merci beaucoup. Jimmy Wedge.